Hi, today we're going to talk about physician burnout and why it's so critical that the doctor themselves actually get optimized to take care of their patients so that they are a better physician, we improve outcomes, and we actually protect patients in their lives. Hi, I'm Dr. James Leonetti from Enliven Center. It's a center dedicated to optimizing the brain, body, biochemistry, and it's all based around your epigenetics and getting a system that works well for you. So let's go ahead and dig right into it. I'm going to go ahead and share my screen. We're going to go ahead and look at these 5 articles. So first, we're going to start off with NPR. NPR says that, based off their data, that medical errors are the number 3 cause of deaths. And in fact, it accounts for 250,000 lives each year. It's third. It's only behind cancer and heart disease. And they attribute it to surgical complications and medicine mix-ups, which are probably one of the most preventable issues for death. In fact, the CDC is looking at adding in medical errors as one of the causes for death. So I'm going to post these articles at the end of the blog so you can go through and take a look at them. But one of the next things we're going to go ahead and look at is doctor burnout is real. And this is from Dr. Parikh. He's an oncologist. We think he's up in Philadelphia. But this talks about his experiences and even like his dreading seeing the last patient of the day because he's going to have to drop bad news. And his thought of this article is we should see more healthy patients, not only one to take care of them, and it helps us to get out of the sick care model and realize that going to the doctor is can be an event for health, not just for sick care, but also from the physician standpoint. If you see more healthy patients and clients, then you're more apt to be more energized and have more energy for some of the ones that are sicker. Now, I know in my practice, I have moved over to more of the optimization and health standpoint, and it's a lot more energizing than when I was dealing with mostly just primarily like really, really sick people and those patients that were in between where they could get the help that they needed. One of the big problems that we look into is EHR. I know I've sat here and plugged away at the computer for hours a day. In fact, we changed our systems a few years ago just for that. But when you look here at the number 2, where it says that internal medicine residents, they spend 5 hours a day for about 10 patient records. That is absurd. That's a lot of time. And even number 1 point was about half the physicians reported symptoms of burnout in 17. This is a big jump. It says a 40% jump from 2013. So again, take a look at this. And one of the big takeaway for the community is, physician burnout costs the industry about $17 billion. So that adds time to your schedule, and it also adds some expense that you could probably end up getting rid of. When you look at healthcare finance, unfortunately, it says physician burnout is high, but most doctors show an outright unwillingness to seek help. Now, I'm going to digress on that and probably disagree a little bit, but it is very, very common with this physician burnout. One of the big things we see there is about 74% of physicians report symptoms of burnout, and they can see it in their colleagues, but a lot of people don't recognize it in themselves. From what I've seen, I've had a lot of friends over the last year or two who've been in practice for 10, 12, 20 years, get really sick, and basically they've given their all to their patients, haven't taken care of themselves, where if we can just step back, take care of ourselves a little bit, fix our brain, fix our body, get our biochemistry back in. If you have autoimmune disorders, start taking care of those things. But basically work on prevention and not trying to catch up. So in the next article we look at right through here, this is right at the top. Burnout doctors make twice as many errors. Again, we just saw that we see about number 3 cause of death. But there is a solution. And when you look at what the airlines have done, because when a pilot, they have to make decision after decision after decision. Now, I realize there's a little different because they go through the same checklist every time. Nothing really changes so much in an airplane. But when you have a patient that comes in, we have diet, we have lifestyle, we have the disease, we have a lot of different factors that go into place. But checklist might be a way to look at this without compromising or adding more time into the whole thing. The other thing is flattening the hierarchies among doctors, nurses, and clinicians, basically so you have better communication, so everybody's basically on the same level. Now, interestingly, with this article, they cite a JAMA clinic. It's down here, a JAMA article that talks about a small but noticeable difference in burnout using mindfulness, positive psychology, and what I love, executive coaching. And so this is definitely one of the areas where there's a lot of room for improvement and customize the plan specifically for the physician. I'm going to add that article right here. It's Controlled Interventions to Reduce Physician Burnout, Systematic Review and Meta-Analysis. So you have access to seeing that. Now, I'm going to stop my share right here. What I would recommend you do is you go through, look at these articles. If any of this resonates with you and you think that you're ready to actually come out and prevent burnout or come out of the burnout, there are systems, there are methods out there. At Alignment Center, we will take you through a full-on, one-day comprehensive physical, probably more extensive than you've had in years or ever. We'll look at brain function, body function, biochemistry, epigenetics. We'll find a program that works for you to help get you optimized so that you can think clearer and handle stresses a lot better. So if you'd like to have a consultation, just fill out the page on enlivencenter.com. Right at the bottom, we'll schedule a 15-minute consultation. We'll see if we're going to be a good fit and if we can help you. Until then,